increased risk of experiencing harms from cannabis, such as mental health problems, including dependence and disorders related to anxiety and depression. But public education and awareness activities have been and continue to be critical to this effort to increase the knowledge among youth. And I want to thank all the community groups and public health experts who are central to these efforts. Since implementation, our data shows that young people are more aware of the harms of consuming cannabis and that the usage has remained relatively stable since the enforcement of the Act. While a lot of progress has been made on the implementation of the Cannabis Act and its dual objectives of protecting public health and maintaining public safety, we need to assess the work that has been done and learn how and where to adjust where needed to meet these goals. L'examen législatif indépendant que nous annonçons aujourd'hui était un engagement que nous avions fait dans la loi sur le cannabis et sera essentiel pour s'assurer que la loi continue de refléter ce qui est le mieux pour la santé et la sécurité de toutes les personnes au Canada. As part of this review process, it is vital that we listen and learn from the public. We are inviting those with lived experience, Indigenous people, provincial and territorial partners, industry, and any Canadian or organization that wants their voice to be heard to share their thoughts. I want to take a moment to thank the Indigenous partners for the very valuable feedback they have already shared with us over the past 3 years. We have published a summary of what we have heard to date and invite further comments through a questionnaire, as well as participating in the extensive engagement the expert panel will undertake with Indigenous partners, which will be critical to the success of this review. Nous restons engagés envers une relation renouvelée avec les peuples autochtones basée sur la reconnaissance des droits, le respect, la vérité, la coopération et le partenariat. The consultation documents are available on the Consulting with Canadians webpage starting today for the next 60 days. We encourage everyone to share their views and opinions. And we particularly want to thank Morris Rosenberg for agreeing to chair this panel. I very much look forward to the findings and recommendations from the panel. Je vais maintenant passer la parole au président. Merci. Thank you. Miigwech.
We'll hear from Mr. Rosenberg, I think.
Yep. Thank you very much. My pleasure to join you here on the traditional unceded territory of the Algonquin and Anishinaabe people. Je suis honoré d'être ici aujourd'hui et d'avoir été choisi par le ministre de la Santé et la ministre de la Santé mentale et des dépendances pour présider le comité d'experts chargé de diriger l'examen législatif de la loi sur le cannabis. When I found out I was going to be doing this, I had an opportunity to look at the report of the panel on a framework for legislation and regulation of cannabis that led to the Cannabis Act, and I was taken by the way in which they framed their work, and I think it's relevant to this legislative review. And I'll just quote very briefly from what they said. They said, "We may not anticipate every nuance of future policy. We're aware of the shortcomings in our current knowledge base around cannabis and the effects of cannabis on human health and development. As a result, the recommendations laid out in their report included an appeal to ongoing research and surveillance and the flexibility to adapt and respond to ongoing and emerging policy needs." Je pense que c'est dans cet esprit que le Parlement a inclus une disposition prévoyant un examen de la législation. Et je crois que les examens législatifs périodiques sont un instrument important de la politique publique en général, étant donné que le contexte dans lequel toute loi a été adoptée à un moment donné continue d'évoluer. But I think legislative reviews are really important, particularly important in a law which charts a completely new path from the one that preceded it. The Cannabis Act is really a dramatic departure from the prohibition and criminal law approach that was the way we dealt with cannabis for the past 100 years or so. This review can be helpful in examining how successful the legislation and the measures taken to implement it have been in fulfilling its public health and public safety goals and in enabling the establishment of a diverse, competitive cannabis industry. Le cadre de cannabis est complexe. Il a des implications dans plusieurs domaines politiques, y compris la santé publique, la sécurité publique, la compétitivité de l'industrie et la diversité. Pour cette raison, il est impératif que ce travail soit mené de manière robuste, en s'appuyant sur des preuves et en tenant compte des perspectives des divers groupes de Canadiens. Engaging broadly with Canadians and a range of stakeholders to gather their perspectives will be critical in helping to inform the work of the expert panel. In this regard, I wanted to echo the words of Minister Bennett that engaging with Indigenous peoples and communities will be critical to the success of this review. I look forward to working with the panel and to provide an evidence-based advice to ministers to strengthen this particularly important piece of legislation and advance public policy in this area in Canada.
That, I guess we'll turn it over to questions.
Thank you very much. Donc, on va passer à la période de questions en commençant par les journalistes dans la salle. On a aussi une longue liste de journalistes sur l'appel Zoom. Donc, je vous avertis d'avance si jamais vous avez des réponses, de peut-être les faire assez courtes là, quand même pour que tout le monde puisse prendre une question. So we're going to go to question period starting by journalists in the room. A reminder for the people on Zoom to use the raised hand function if ever you do have a question, and I will unmute you. Alors, on va commencer avec Kim Vermette de Radio-Canada.
Bonjour à vous tous. En fait, j'aurais une question pour vous, ministre Duclos. J'aimerais vous parler du pont de Québec parce qu'on lisait ce matin que Yvon Charest, qui a été mandaté par Ottawa, s'inquiète d'une démolition potentielle du pont, qui accuse aussi le gouvernement de Québec de bloquer l'entente entre votre gouvernement puis le CN. Vous en pensez quoi de ça?
Bien, comme beaucoup de gens à Québec, je suis ce qui se passe. J'entends dans ma circonscription, j'entends le maire de Québec, des gens qui veulent plus d'informations sur à la fois l'utilité et les coûts du troisième lien. Ce qui est clair, c'est que l'utilité et les coûts de restaurer le pont de Québec sont solides. Alors, l'utilité, c'est 35 000 véhicules par jour et les coûts, c'est quelques millions, entre 3 et 5 millions apparemment, selon M. Charest, par année. Donc, c'est très modeste par rapport à un investissement qui serait nécessaire pour un troisième lien. On a besoin à Québec de notre premier lien, le pont de Québec. L'utilité est évidente et les coûts sont très modestes par rapport à l'autre projet.
On s'approche de la date butoir du 30 septembre pour s'entendre sur les modalités financières pour le renouvellement de l'accord. Est-ce que ça vous inquiète de voir qu'on n'est pas près d'une entente puis qu'on s'approche de la date butoir?
M. Charest l'a dit très clairement, c'est notre négociateur. C'est un négociateur en qui beaucoup de gens dans la circonscription et dans la région de Québec ont confiance. On sait que c'est quelqu'un de solide. Il a toute ma confiance, il a toute notre confiance. Il a dit très clairement, les délais sont courts, il faut travailler pour que ça avance. Ce genre d'entente est fragile et il faut arriver à une solution rapidement.
Marina from CBC.
Good morning. We know that Canada's cannabis producers are struggling. They say that they're having to throw out more than they're actually able to sell, in part because of limits on how much they can sell domestically, as well as not having access to international markets. So what are you doing to ensure that this industry is viable?
Well, that's as you heard from Mr. Rosenberg and from Nate, and as you would hear if you were to listen to the industry, this is part of the mandate of the panel. So the main focus is the safety and the health of Canadians. This is a priority. Everything else is secondary to securing the health and safety of Canadians. However, as we work with partners, economic partners, we know we can better support and protect the health of safety of Canadians. We've demonstrated that since 2018 by having so many partners engaged with Health Canada and with the government. We are able to achieve now almost 70% of the total consumption of cannabis being accessed through the legal, regulated, and safe cannabis market. And that's because, obviously, of what happened in 28, but more importantly, that's because of the credible work that the industry and many others have done over the last years.
You mentioned public health. We know that a new study from Sick Kids and the Ottawa Hospital found they're seeing a spike in children being admitted because they've been exposed to cannabis since legalization. So what are you doing to ensure the public safety perspective of this and that we don't see this continuing?
I'll turn in a moment to Minister Bennett, who, as you know, has a long experience in public health and in the safety benefits of a focus on public health. So the counterfactual is what would happen, or what would have happened had cannabis not been regulated and legalized. No, it's sometimes difficult to remember what was happening before 2018 and what would have happened since then had we not made that decision together and not seen the significant progress that many have produced over the last 4 years. Carolyn?
Yes, I think that we've done well in terms of the public education campaign, but I think since the advent of edibles, that we need to do more, and that I think that families need to ensure that it's in a safe place where children can access it, and I think everybody agrees with that. But I think that having a legal supply is going to, and regulated supply becomes hugely important as we face this toxic drug supply across this country. So I think that we need to do more, but I think that again, that this is something that the panel will look to, but I think that we won't be waiting for the panel to be able to help Canadians keep their children safe.
Can I just add, from a parliamentary perspective, one, criminalization of cannabis came with incredible harms. And so there will always be public health harms to alcohol use, to cannabis use, and to any number of substances that people can consume as responsible adults. And the public health approach has to be about reducing harms and taking a broader look at a public health approach to say, how can we best regulate activities to reduce harms? And I think edibles are a good example of saying, how are we going to have a sensible edible framework that is going to enable Canadians to be responsible adults on the one hand, but also reduce harms for kids. I would also say, in terms of the industry perspective in your first question, it's very important, I think, that the government has taken a broader view of this review for the purposes of displacing the illicit marketplace, which depends on empowering industry in a serious way. But I would also say that in the short term, because this is an 18-month review and action will come after those 18 months as far as the government is concerned. And so in the short term, we do have to be concerned about, from an industry perspective, from a consideration of displacing the illicit marketplace, what does the excise tax look like from a federal perspective? What are barriers that federal regulations, what barriers exist at the federal level that we can remove in a short-term way to empower the industry? And we've already embarked upon this. When you look at the silly limits that were initially in place around quantity instead of potency. So when I would go buy my 2.5 milligram beverages, I could only buy 5 at a time. It made no sense at all. And Health Canada went and looked at that and said, this rule doesn't make any sense. Let's change these rules. And so there has to be that same process from a Health Canada perspective and from a government perspective to say, if we care about displacing the illicit marketplace, Mr. Rosenberg has to do his work, and I have great confidence in his work and in the government's response. And I'm very glad to see that that's been incorporated into the scope of the review. But there is an urgency to this as well, and if there are short-term actions we can take, we should take them.
Raymond Fillon, TVA.
Sur le champignon mortel qu'on appelle le candidat au risque, ça fait beaucoup jaser aujourd'hui. Je demandais de votre point de vue au fédéral, est-ce que c'est quelque chose qui prend de l'ampleur? Avez-vous des détails au sujet du nombre d'éclosions au Canada actuellement?
Effectivement, c'est quelque chose qui préoccupe beaucoup de gens depuis quelque temps et qui me préoccupe aussi et qui préoccupe la santé publique fédérale. Et j'aurais demandé de nous revenir rapidement avec des données biomédicales et épidémiologiques sur la situation, et j'espère pouvoir les communiquer rapidement avec leur aide.
Selon ce que vous en savez?
C'est ce que la santé publique doit valider. Évidemment, les informations sont surtout dans le domaine des provinces et territoires. C'est eux, évidemment, contrôle les informations générées par les, les opérations, les tests cliniques, les diagnostics du système de santé au Québec et ailleurs. Donc, ça prend un petit peu plus de temps pour la santé fédérale d'avoir accès à ces informations, mais je vais demander d'accélérer le rythme d'accès et de partage de ces informations.
Ian Wood, CTV.
Minister Duclos, I just want to ask you about the ArriveCAN app. So it's been suggested that this is going to be gone soon. Your cabinet colleagues have signaled that this is more about digitizing the border. So I'm just wondering if you can explain to me what is it still doing to impact the the Quarantine Act? What role does it play there? How much is this doing to stop the spread of COVID at this point? That app.
Thank you. Two answers on that. The first one is that in the context of public health measures being imposed at the border, as Minister Algabra and Minister Mendicino have said repeatedly, ArriveCAN is an essential tool. If we didn't have ArriveCAN, the time it would take for border agents to process the data that are needed for to monitor and enforce the rules around the border, that time would be tripled by 3. So obviously that would cause a lot more difficulties, both at the land and at the air borders. The second thing I would say that ArriveCAN is also being increasingly useful to treat customs data. In Montreal, in Toronto, and in Vancouver, those that are using, and there's quite a large proportion of them using ArriveCAN to enter their customs data, those that do so, they reduce by half the time it takes to go through borders. That's obviously great for them. It's also great for border agents who can spend more time with people that may need a bit more help to cross the border. So in some cases, you don't even see an agent. You just show your passport. The machine recognizes that you filled in your customs data through ArriveCAN, and you whiz through the customs area. It makes it therefore less costly in terms of time and resources for travelers, and also less costly for the system overall.
But if this was in fact the goal to digitize the border like that, this would not be something that was foisted on Canadians, be it the pandemic that caused that. This would be something that would be implemented through a pilot project, and it would be years of implementation before it was a full-on program. So is this not at this point here, it sounds like this has really nothing to do with COVID. It's more an administrative thing. So are we not unjustly burdening Canadians who maybe aren't as technologically adept, or maybe don't have a smartphone if they're crossing the border? I mean, you talk about long lineups. There isn't an app to go into the US, the United Kingdom, the EU, I don't believe. It seems like a burden.
And the key word here is respect. Absolute respect for people's conditions when they cross the border. So if people have difficulties using the technology, they have to be treated with respect, both at the land and air borders. That's true for public health reasons. It's also true for customs data treatment. So you're quite correct. So if people have difficulty handling technology for all sorts of reasons, they need to be treated with respect.
On va aller sur Zoom. Alors, on commence avec Émilie Bergeron de la Presse canadienne.
Oui, bonjour, Monsieur Duclos. La loi demande un examen dans les 3 ans. Donc, ça voudrait dire qu'il y a environ 1 an de retard pour lancer cet examen-là. Qu'est-ce qui explique ce retard-là?
Merci pour la question. En toute honnêteté, nous aurions voulu lancer la revue au printemps dernier. Mais on a préféré prendre un petit peu plus de temps pour faire les choses correctement. Et il y a 3 façons dont on les fait, je pense, mieux maintenant qu'on les aurait faites à l'époque, au printemps dernier. La première, c'est que nous avons un comité indépendant et solide, indépendant de la fonction publique, un comité donc qui va être plus capable de travailler avec la communauté de leaders et des partenaires solides que nous avons. La deuxième, c'est que le mandat du comité est plus étendu que le mandat qui avait été antérieurement prévu. Si on regarde dans la loi, il y a une définition beaucoup plus stricte de l'obligation du gouvernement de passer à une revue de cette loi. Et la troisième chose, c'est que comme on a un panel qui va être plus diversifié de par sa composition et plus expérimenté et plus indépendant, bien, ils vont être capables non seulement de parler du produit et de la protection de la santé et de la sécurité des gens, mais aussi d'autres aspects, comme les aspects économiques, sociaux, même environnementaux, et aussi les aspects d'équité. La loi, même si elle est beaucoup meilleure que ce qu'on avait avant 2019, avant 2018, n'est pas parfaite. Elle peut avoir des impacts plus durs pour certaines populations, donc il est important de considérer cet enjeu. Et aussi la capacité des Canadiens et de l'industrie d'être inclusive dans les bienfaits économiques que cette légalisation peut apporter. Donc l'accès au marché des entrepreneurs, aux entrepreneurs et au marché du cannabis de populations qui sont présentement trop exclues. Et donc, comment est-ce qu'on peut, avec le travail du comité, là, remédier à tout ça?
J'aimerais aussi vous entendre sur la culture du cannabis à domicile. Comment ça va faire partie de la révision, puisqu'on sait qu'au fédéral, la loi permet d'avoir jusqu'à 4 plants à la maison. Il y a des provinces, le Québec, le Manitoba, qui ont décidé, eux, d'avoir une loi plus sévère qui interdit d'avoir tout plant à la maison. Est-ce que ça pourrait changer et être resserré au niveau du fédéral?
Effectivement, c'est une des... quand on parlait d'étendue du mandat, ben, ça fait partie d'un des éléments du mandat qui n'était pas considéré au départ, ou qui était moins considéré au départ, donc les enjeux de production à la maison. On sait que c'est une compétence partagée avec les provinces et territoires, et M. Rosenberg et le comité vont, de par leur travail, pouvoir à la fois informer le gouvernement canadien sur la façon de continuer de progresser sur cet enjeu et sur d'autres enjeux, mais cette information et ces recommandations vont aussi être utiles, j'en suis certain, pour les provinces et les territoires.
We'll go to Brian Passafiu, National Post.
Hey, good morning, everybody. First question is, as you know, this review is supposed to begin at the 3rd anniversary of legalization, which was a little under a year ago. Why was this review so late in getting started?
I can do that in English this time, since I tried to answer it in French just a moment ago. Well, we would have liked, in all honesty, we would have liked that to be announced spring or early summer 2022. But when we were ready to do that, we triple checked with the partners, public safety, public health, and the industry. And we decided to wait a few more months to make sure, until today, to make sure we did 3 things better. First, independence. Second, the scope. And third, the engagement. First, independence of the committee. This is an independent committee, so it has the ability and the capacity and the freedom to do whatever it thinks it should be doing in the context of this important review of the legislation. Second, the scope. If we look at the legislated mandatory scope of the review, is a lot more narrow than what we're announcing today. And I believe, and we hear from many experts and leaders and actors in the field that this is the right thing to do. Now, looking at the whole set of impacts and connections related to the cannabis law. And third, the fact that we have such a strong mandate, strong panel, that will enable a review that will be a lot more engaged, consultatively, from a consultation perspective, the work will be stronger. They'll be able to listen to and learn from many, many actors, including indigenous communities, Canadians that may have not benefited as much as others from the legalization that took place in 2018. Those Canadians, for all sorts of socioeconomic reasons, that may not have been able to access the entrepreneurship associated to the new industry. So all of these people's input will be better integrated into the work of the panel because of that little step that we wanted to take before we would announce the review.
Just to echo